And joining us on Zoom. My name is Kemi Amodu, and I am genuinely glad you came to listen today to my talk. So for the next 40 minutes, I want to take you inside research that is very close to my heart, professionally and personally. The title is Gender, Displacement, and Community Wellbeing in Nigeria. The subtitle carries three words that are not decorative: evidence, dialogue, policy pathways. Evidence is what 6 months of intensive ethnographic fieldwork found in two informal settlements in Nigeria's Federal Capital Territory, Abuja, in 2025. Dialogue is what happened when we took those findings to a dialogue table on February 25th of this year, just 3 weeks ago. We convened a high-level policy dialogue and expert roundtable in Abuja. 62 stakeholders, government ministries, international organizations, civil society, and crucially community representatives from the very settlements where the fieldwork was conducted, sitting at the same table as the policymakers who govern their lives. And pathways, because evidence and dialogue are meaningless unless they lead somewhere. This talk is about what it takes to close the gap between written commitment and lived reality. So I will draw on these two sources today, where I describe conditions in the settlements. I am drawing on the fieldwork transcripts, where I reference what government agencies confirmed or what policy actors said. I am drawing on the February dialogue. Both are essential to the full picture today. This research was funded by the Social Sciences and Humanities Research Council of Canada, my partners at the University of Abuja, and Nigeria's Federal Ministry of Health. Before I show you any data, I want to situate myself because in this kind of research, who the researcher is shapes what they can see and what they are responsible for. I trained and practiced as a registered nurse in Nigeria. My clinical background was in reproductive and public health. That bedside experience is the foundation of every research question I ask. I came to academia because I kept seeing the same structural problems. Women face reproductive health challenges, unable to access care, not because they don't want to, but because the systems were not built for them. And I kept realizing that clinical answers alone cannot provide lasting solutions. My SHRC-funded project focuses specifically on gender and conflict among displaced populations. Today's data comes from fieldwork in two informal settlements in Abuja's Federal Capital Territory. Before I take you inside the fieldwork, we need some more context, right? We need to understand that displacement has a history, and that history shapes everything about the present conditions. Three overlapping crises have produced Nigeria's displacement emergency. The first and most devastating is the Boko Haram insurgency. For those less familiar with the Nigerian context, Boko Haram is a jihadist armed group whose name translates roughly as Western education is forbidden. The group began a systematic campaign of violence in Nigeria's northeast from 2009, reaching a catastrophic peak between 2014 and 2016. Entire villages across Borno, Adamawa, Yobe states, three northeastern Nigerian states that sit at the epicenter of the conflict, were attacked, burned, and depopulated. Young men were forcibly conscripted, families that refused faced massacre, millions fled. Every single one of the 30 individuals respondents in this study came from one of these three states. This is not a crisis of distant statistics. It is the origin story of every person that I spoke with. The second driver is what is known as the farmer-herder conflict. As climate change shifts traditional cattle herding routes across north-central Nigeria, violent clashes have escalated between farming and herding communities over land and water access. This produces a secondary and distinct wave of displacement that receives less global attention, but is equally devastating to the families caught inside it. The third is climate displacement. Nigeria is one of Africa's most flood-prone countries. According to the United Nations Office for the Coordination of Humanitarian Affairs, known as OCHA, 34 of Nigeria's 36 states were affected by severe flooding in 2024 alone. In that single year, 896,000 people were displaced, and 1.3 million hectares of farmland were destroyed underwater. Enough farmland, OCHA calculated, to feed 13 million people for a year. These drivers interact, compound, and feed each other, and they sit within a global crisis that has reached unprecedented scale. The Internal Displacement Monitoring Center, IDMC, documents 83.4 million people living in internal displacement worldwide as of the end of 2024, more than twice the number from just 6 years ago. Sub-Saharan Africa alone accounts for 38.8 million of these. Nigeria, Burkina Faso, and Cameroon together account for over 80% of internally displaced persons across West and Central Africa. Now, this is the world the people I met stepped into when they arrived in Abuja. Now, let me tell you what arrival actually looked like for someone, because numbers alone do not carry the full weight of it. August 8, 2014, the night everything changed. Statistics about displacement can feel very abstract. So let me take you inside what this crisis looked like for one person on one night. Because participants after participants in my fieldwork across both settlements, across different interviews, recall the exact date their lives changed with extraordinary precision, the way people remember the day their world ended. One deputy camp leader, a man who has lived in that settlement for over a decade, originally from Adamawa State, has been one of the primary organizers and advocates for the community throughout his time there. When I asked him to take me back to the beginning, to tell me how his community came to be in Abuja, this is what he said. The insurgency came to our area on August 8, 2014. In the beginning, they only came for police and soldiers. After they overpowered security forces, they came back house to house, looking for young men to recruit. When people refused, there was violence, massacres. We had no warning, we had no time. Now, that same night, I want to note that multiple participants interviewed separately described this the same way without any prompting. A heavy rainfall started at around 10 p.m. and did not stop until 4 a.m. The deputy camp leader described it as sent by God, because in the chaos and the darkness and the rain, people could run. Many made it to the mountains. That is how they survived the first night. From there, families dispersed. Some fled through Cameroon, others moved between Nigerian states, north and then west, eventually reaching Abuja. The journey took months, for some families, years. And then the deputy camp lead said something I have not stopped thinking about since he said it. I am the only man left in my family. We're 19 in number. The whole 18 are gone. I do not know where they are. Some I know are dead, some I never found. I'm the only one who came out. He said this without self-pity, as a plain fact about the arithmetic of what this insurgency did to his family. 19, 18 gone. Now, over 11 years after that night, he is still in the informal settlement. When I conducted this fieldwork in 2025, he was still there, still leading, still advocating, still holding the community together. More than a decade of living in an informal settlement in Nigeria's capital city, with no formal IDP status, with no stable land tenure, with no end in sight. So this is not a temporary emergency. This is a protracted structural generational displacement, and understanding that duration is essential for understanding everything that follows. So a question I am asked regularly is, why Abuja? The violence happened in Nigeria's northeast. So why are you studying people in Abuja? Why do displaced communities end up in the Federal Capital Territory anyway, hundreds of kilometers away? There are four interconnected reasons, and they matter for understanding the political and institutional landscape of everything that follows. First, proximity to power. Coming to Abuja is not accidental. It is strategic. Displaced people come to the seat of government because that is where decisions are made. They believe this makes them more visible to the government. It is itself a survival strategy and a form of ongoing political pressure. The second reason is perceived safety. The Federal Capital Territory is seen as more stable than the Northeast, which continued to experience periodic violence after 2014. The first families to arrive found relative physical security, even if services and formal protection never followed. Now, the third reason is institutional presence. Nigeria's National Commission for Refugees, Migrants, and Internal Displaced Persons, known as NCFRMI, headquarters are in Abuja. Communities settled near the institutional actors, hoping that this might support them, or they might support them, even as those institutions, as we will see, have largely not been able to meet that expectation. There's also another reason, which is chain migration. Once the first networks of displaced families formed in Abuja, others followed. Friends, family members, people displaced at different points in the conflict used established routes to reach communities already in the capital. The result is 18 informal settlements scattered across Abuja's Federal Capital Territory, housing over 37,000 people, a figure stated by NCFRMI's own representative at the policy dialogue we held in February of 2026. Now, these communities came to Abuja with intention and with strategy. They came looking for protection and proximity to the institutions that owed them that protection. Not IDPs, settlers. I need to explain something before the findings that is fundamental to understanding them. So it begins with a single word, and that word is camp. A community coordinator explained that the government classifies displaced communities as officially internally displaced persons only when they are located in the Northeast. Those designated camps receive formal state recognition, access to services, legal protection under Nigeria's national IDP policy of 2021. But the two settlements that I studied are classified as informal settlements. So not official camps, just settlements. And that single classification strips residents of every legal entitlement the state is supposed to provide. So this has some consequences. The first consequence is that this limits access to emergency management engagement. Nigeria's National Emergency Management Agency, alongside State Emergency Management Agency, SEMA, is responsible for disaster response, similar to the mandate of Public Safety of Canada. However, across 2025 field work, participants consistently described these agencies as present in records, but not in the field. At the same time, they were largely absent from everyday community life. As of February 2026, Abuja Policy Dialogue, a NEMA representative clarified why. She said, for NEMA to be present in camps, those camps have to be formal camps. Where there is no formal designation, our mandate does not reach. So this highlights a key constraint. Without formal recognition, agencies are structurally unable to operate. There's also the breakdown of health referral systems. A lot of the participants spoke about the difficulty with accessing hospital services because a lot of times the NCFRMI office has to provide a referral to you to get hospital care. And because a lot of times the NCFRMI itself is short-staffed, they're not able to even find someone at the desk. The third consequence is chronic eviction and instability. These settlements have faced over 25 evictions since 2014 with no secure land tenure. The most recent occurred in Ramadan of 2024. As one community leader describes, we build, they come and take it down. For 10 years and still we are demolished, but we are still here. This reflects sustained instability and the burden of repeated displacement. Now, the community response, in the absence of state support, communities have built their own systems, governance, food distribution, health support, education. What emerges really is not failure, it's actually self-organization. And that distinction is central to understanding how health, autonomy, and decision-making operate in these settings. Critical ethnography in two settlements. This study is a critical ethnography study. Now, for colleagues more familiar with clinical or quantitative research, critical ethnography simply means we made repeated visits to both settlements over a period. We sat in on everyday life and have built relationships over time. Crucially, every participant, every displaced woman, every camp official, every NGO worker was treated as a co-interpreter of their own social world. Why critical ethnography and not a survey, a longitudinal cohort study? Because these communities are repeatedly evicted. That's the reason they move. They have no stable registration system. A cohort study is impossible here in the way you might build one in a hospital or a community clinic setting. Qualitative critical ethnographic methods are not a second best option. They are epistemologically correct, especially the choice for this population that standard research designs simply cannot capture. Our data set comprised of 30 in-depth interviews with displaced women and men conducted in both English and Hausa, which is the ethnic language in that community, with a bilingual research team. A key informant interviews with camp leads who had been embedded on site for between 5 and 12 years, and 4 focus group discussions, 2 per settlement. We obtained dual ethics approval, so from Nigeria's National Health Research Ethics Committee, known as NREC, which is the primary national body overseeing health research ethics in Nigeria, and from the University of Alberta's Research Ethics Board. Our 30 core respondents were 18 women and 12 men. The ratio toward women was intentional. This study really focused on women's experiences of displacement, but as well, men were essential because we couldn't really understand how gender would sort of play out in that context or interact with other factors in that context without fully understanding how masculinities are being reconfigured by these conditions. 28 of 30 respondents had been displaced for more than 2 years, so not a temporary emergency, as I've already established. These are people in the 3rd, 4th, 5th, or 6th year of living in informal settlements with no clear end in sight. The religious split was exactly equal, 15 Christians and 15 Muslims. This was not engineered by sampling design. It reflects the genuine religious plurality of the communities from which these participants came. Employment. Of the 21 respondents for whom we could recover employment data, 19 were formally unemployed, so didn't really have any employment in the formal sector at the time of the interview. Only 2 were formally employed. Petty trade, selling firewood, running small food stalls, selling cooked food was the most common survival activity, but it did not register as formal employment in official sense. The ethnic composition reflected Northeast Nigeria's remarkable plurality or diversity. Hausa, Fulani, Glavda, Mandara, Lamun, and Madi communities, among others. Now, before I move into the core findings, I want you to hear a voice from the sample, a woman from one of the settlements, a farmer who, was a farmer before displacement, now living in the settlement. She said, back then in our villages, we women were so hardworking. We had farmlands. I was growing corn, beans, sesame seeds. I worked every day. I knew my land. I knew what I was building. But we came to the IDP camp and we're here doing nothing. Not because we want to do nothing, but because there is nothing to do here that is ours. This is what it sounds like when someone's economic identity, their productive land, and their sense of self have all been taken from them in a single night. Thematic analysis of the 42 transcripts generated 5 main findings. I want to name them precisely because the distinction between them matter analytically. The first finding is that there's a governance paradox. So women perform the substantive labor of community self-governance, aid distribution, dispute mediation, birth attendance, documentation. Formal decision-making authority, however, is held from them. This is a finding about power and recognition. There was also a finding around economic inversion and its health consequences. So displacement has reversed the pre-conflict gendered division of labor, and women are now primary income earners as a result of the survival strategies. And that reversal produces measurable physical and mental health burdens that the formal health system cannot absorb, both because it is inaccessible and because it is structurally compromised. Now, the finding three, reproductive health and justice. There are four dimensions of this in women's reproductive and maternal lives, produced by the intersection of informal settlement classification, state non-payment of hospital commitments, and absence of community-level health infrastructure. The fourth finding is violence and contested norms. Gender-based violence in these settings is structurally produced by age child design, by the economic inversion documented, and by enforced male idleness. Cultural rationalization, although present, is not the primary driver of intimate partner violence. Structural abandonment was the last finding, the gap between policies that exist on paper, the NCF-RMI Act of 2022, the National Internally Displacement Persons Policy of 2021, and the Emergency Department Health Care Center Scheme. So without further ado, we'll move into the findings. In depth. So the governance paradox is the first and analytically the most structurally important finding because it establishes the contradiction that runs through all the others. Women manage the primary functions of community self-governance. So aid distribution is administered through a documented, photographically verified system designed by the women's groups themselves. Every donated item is recorded and divided proportionally. Beyond distribution, women's leaders conduct dispute mediation, they run gender-based violence reporting hotlines, manage cooperative savings structures, and coordinate emergency responses. Formal governance authority, however, is entirely male. The chairman holds all final decision-making power. Women are consulted on what the camp secretary described as social matters that affect women, but their input does not bind outcomes. I think we have a quote there that says, on a scale of 1 to 10, 1 woman to maybe 7 men, that is already an exclusion. Leadership of this camp is more towards the men. The women will be called and they will always come for the distribution. They will always be there to do the work. But at the end of the day, does it really get to the women? Does the power actually reach them? I have been here 5 years and I'm still asking that question. And this came from one of the NGO staff at one of the camps. So the governance paradox names the specific mechanisms by which care labor and governance labor activities performed by women that are indispensable to the community survival fail to generate corresponding authority or recognition. The existing forced displacement literature tends to either frame displaced women as passive victims of structural conditions or to identify governance adjacent activities as evidence of empowerment. Both framings are analytically insufficient. What the data shows is indispensable function without commensurate authority, a form of structural subordination that operates precisely because women's governance labor is necessary and therefore tolerated, but not recognized and therefore not compensated or protected. The policy implications follows directly. Formalize governance roles, attach them to real decision-making authority, and compensate the labor. Moving beyond women as aid recipients is not a rhetorical shift, it's a structural redesign. Now, the second finding is the reversal of the pre-displacement gender division of labor and traces its consequences for women's physical and mental health. In the Northeast Nigerian communities from which many participants originated, the dominant pre-displacement economic structure positioned men as primary income earners. So displacement, however, has comprehensively changed this. Women are now the primary income earners in many households through firewood collection, sale, urban edge subsistence farming on borrowed land, and petty trade in cooked and raw foods, foodstuffs. So in many households, women are the sole earners. There was one quote which I found very interesting by one of the settlement leads saying that women actively engage to bring food to the table. They go out early, they come back late, they carry things, they sell things, they cook and they sell because the men sometimes do not know what to do. Maybe they're confused by everything. Maybe they have a trauma they do not talk about, but the women move. They always move. Not sure if I have it on the slide. So Men's economic displacement has produced what the data consistently describes as a specific form of masculine fragility, the loss of the breadwinner role, compounded by exposure to urban enforcement actions that seize income-generating assets, city authority crackdowns on motorcycle taxis, a primary income source for men in these settlements produce a recurrent pattern. So the health consequences of this economic inversion fall disproportionately and severely on women. Female-headed households and widows managing multiple dependents reported chronic physical and mental health deterioration that is directly attributable to the intersection of survival labor intensity, financial precarity, and the absence of accessible health care. This testimony from a widowed woman at a settlement kind of captures the real picture of what this looks like. I think I had it here. Mhm. Everything about the children, the responsibility is on me. Their feeding, their clothing, their school fees, everything. When I don't make a sale, I get depressed. I cannot sleep. I lie awake thinking about what they will eat tomorrow. If there is anyone sick, we go to a chemist, a small pharmacy, because we cannot afford the hospital. We have never been able to afford the hospital. There was a time my blood pressure was over 200, and I still want to sell firewood the next morning because there was no one else. So I'll quickly go to intimate partner violence and obstetric emergencies that come through the situation of displacement. So practitioners across both settlements described overt sexual violence in public settlement spaces as limited in terms of reported incidents. But every single practitioner I spoke with immediately added a caution. Low reported rates almost certainly reflect stigma and fear of disclosure, not low actual rates. As one of the camp secretaries told me, many women will not want to spoil their husband's name, so they carry it. They tell maybe their mother, the mother takes it up quietly. It does not come to us as a formal report. It stays inside, but it is there. It is always there. And this was one quote that that one woman leader and community birth attendant said during the interviews. She said 3 days ago there was a woman. She came to me bleeding. Why was she bleeding? Because the husband beat her. He beat her while she was pregnant. We were lucky there were some NGO people there that day. We put together money. We got her to help. We thank God that she delivered safely. And when we gave her the remaining money afterward, you know what the first thing she said was? She said, I don't have any money, any food in the house. Can people use this money to buy food for my family? That was her first thought. After all of that, food for the children was her main priority. So in terms of emergency access, one of the things that we found is that the access is really poor within this communities. One of the health challenges here, one of the quotes, for example, talks about the health challenges here go from antenatal to delivery to postnatal, and it has been very, very poor. Emergency cases are rejected. Why are they rejected? Because the government has not paid the hospitals. The government committed to pay and they did not pay. So patients come with no money and the hospital says we are owed by the government. We cannot take you. I have gone to that hospital myself. I have stood in those corridors. I have argued with doctors. People were being held for unpaid bills. Medication was being stopped in the middle of treatment. A man came to me once and said, they stopped my wife's medication because the government account is empty. What do I say to that? What do I tell them? And this was a quote from a senior coordinator from one of the settlements who had been there 12 years on the site. So in terms of violence, trauma, and contested norms, one of the things that we identified is that the way that the aid was distributed were contributed to the factors that led to women sort of being experiencing violence in that context, because a lot of the time the aid was going through the women, and that created some sort of reaction or backlash from their male partners. So this is a quote that describes it really well. The aid organizations come and they call the women. They give to the women, and some of them they feel bypassed. They feel like she's getting things, she's deciding things. She does not need me anymore. And from there, it results into violence. She does whatever she likes, they say. From there, it results into beating. It has been justified in their minds. I am not justifying it, I am describing it. This was a quote from an anonymous respondent. So the fifth and final finding ties everything together, and it is two stories at once, one about what communities have built and one about what the state has failed to deliver. Let me start with what communities have built because I want to be unambiguous about this. What the settlements have constructed in the absence of state support is not coping, it is actually governance. They have built transparent, photographically documented aid distribution systems, women's groups, traditional birth attendance networks. One woman leader, for example, mentioned, I conduct delivery sometimes with my bare hands, without gloves, without equipment, without considering the risks to myself, just to save the mother and the child. Because if I don't go, who goes? There is no one else, so I go. Community gender-based violence hotlines provided by an NGO partner is one of the ways that people are able to report experiences of gender-based violence within the community. So basically, these communities have become self-governing communities. They deserve to be recognized, resourced, and respected as such. What they have built deserves a name other than coping. And on the other side, Nigeria's National Emergency Management Agency, NEMA, and its state emergency management agency counterparts were described by participants across both settlements in the 2025 fieldwork as present of only in office records, but not in the field. Government designated hospitals are rejecting emergency internally displaced persons because the federal government did not pay the hospital bills it committed to paying. Patients are being detained, medication is being discontinued mid-treatment. Now, the Kampala Convention has been ratified for many years now by a number of countries. Nigeria is one of the countries that has ratified the Kampala Convention, which is the African Union Convention for the Protection and Assistance of Internally Displaced Persons in Africa, which would give these communities binding legal protection under international law, but has yet to be domesticated into law. I believe there has been some conversations about implementing this law within this current government in Nigeria, but not sure how that is translating to actual improvements within the setting. So 3 weeks ago, February 25th, we convened the high-level policy dialogue and expert roundtable on gender, displacement, and community well-being. It was held in Abuja, convened by the University of Alberta, represented by myself, the University of Abuja, and the Nigeria's Federal Ministry of Health. One of the things that came through recommendations included that women are already governing. The governance paradox shows us that the question is not whether women can lead, it is whether we can formalize, fund, and compensate that leadership. That means formal governance roles with real authority, and that means payment for the distribution and mediation labor that is currently done for free. That means women are decision-making parity in all settlement governance structures and not just in the room for consultation. In terms of maternal health, Health posts are needed urgently inside and adjacent to informal settlements, not kilometers away with a form required to access them. The Nigerian federal government must honor the hospital cost commitments it has made in writing and fail to deliver so that hospitals stop turning away emergency patients. There's also need to engage men in gender responsive, gender-based violence programming, not just in design of programs, but also in the implementation of it. The evidence is clear. Norm change campaigns without structural accompaniment produce backlash. The International Organization for Migration was explicit at the Abuja dialogue. Mental health and psychosocial supports are needed. Trauma must be managed as they are structurally produced and not as just a personal deficit. I want to also add something from the data that women leaders are already attending births, attending with their bare hands, counseling survivors of violence, mediating disputes, running distributions. They also need support. They need support in every area. Agro-business is really important, especially for cooperatives registered through the federal government. Small and medium enterprise development agencies and the likes are already present. Improving financial skills training is one of the needs within that population, and even tax holidays, because with the new implementation of tax in Nigeria, women can potentially benefit from such tax holidays and fee waivers, especially those who have cooperative groups. Now, this study advances um, the thinking in many ways. First, the governance paradox. This challenges both the passive victim narrative and the simply empowered by displacement narrative in forced displacement literature. Women are indispensable to community governance. While that governance occurs inside structures that simultaneously constrain their formal authority, that tension is theoretically generative and practically urgent. The men in this study are not a monolith of perpetrators or absent fathers. Economic inversion, challenges with finding work has produced specific kinds of fragility, specific violence, but also specific openings for intervention. Programs that ignore this complexity will eventually fail. The structural production of gender-based violence shows that decisions generate intimate partner violence risk at system levels. Decisions around aid distribution, decisions around who we engage and who we do not engage. Moral economies of care, what these communities have built in the absence of state support, is not called coping, it's called governance. Recognizing that distinction has direct resource and policy implications. Now, in terms of how that applies or how this work applies to us where we're sitting right now, there is that connection because Canada resettles refugees from the exact communities I studied. The structural dynamics of displacement, the governance barriers, the economic inversion, the reproductive health failures do not stop at immigration checkpoints. They follow people here as well. And because Canada resettles many refugees every year, the structural dynamics of displacement, the issues with governance, barriers to reproductive health do not disappear when people cross the border. They only transform. They present differently in an Edmonton clinic or a Calgary Community Health Center than they do in a settlement in Abuja, but the structural logic is the same. I just want to close with four words that emerge from the community themselves, not from any single interview, but generally across the settlements. And the word is just that we are still here. We are still here. We're still here. Thank you.